everyone. My name is Arushi Gupta and I'm a fourth year medical student, and today we are going to discuss about different types of headaches. As you all are aware, headaches can be of a few different types. Mainly we have cluster headache, migraine headache, tension headache and medication overdose headache. The ones which we are going to emphasize more on today are going to be cluster headache and migraine. Let's start with cluster headache. So, cluster headaches are more common in males. This is usually associated with your circadian cycle, and that's why it usually disturbs the person when he is sleeping. What are the classic symptoms which are associated with a cluster headache? That includes unilateral periorbital pain and rhinorrhea. Now, these symptoms can recur up to 8 times or even more each night. So you can think that how painful and how frustrating it is for the person because they're constantly getting disturbed in their sleep. So we said it's more common in males, it disturbs the sleep, it's a unilateral pain, it is associated with periorbital pain and rhinorrhea. Now let's talk about how do we treat it. So acutely you treat the person by giving him 100% oxygen. How does oxygen help? So, oxygen displaces the carbon dioxide in the brain, which was causing the vasodilation and the headaches. When the person was given oxygen, that displaced it, causing the vasoconstriction and ultimately resolution of the headaches. Now, what can you give this person for prophylaxis? For prophylaxis, we can give the person something called verapamil, which is a non-dihydropyridine calcium channel blocker. Acutely, you can also give the patient a triptan like a sumatriptan. Now, let's talk about the next one, which is a migraine headache. Migraines are very common. They are seen more commonly in females as compared to males. Now, migraine headaches are also unilateral. These can be seen classically with aura or without aura. Why do you see an aura? So aura is basically something the patient feels around themselves, which is because of irritation of their cranial nerves, especially cranial nerve 5, the meninges and the blood vessels which are associated. What are the classic symptoms? So it's associated with a pulsating unilateral headache, nausea, vomiting, etc. Now, what can actually trigger a migraine? So it can be flashing lights, it can be stress, it could be any lifestyle changes. Now, let's see. So, what do you give for treatment acutely? Now, for acute treatments, we can give patients something like an NSAIDs or a triptan, as we said, a sumatriptan or an ergot alkaloid. Now, we have to talk about what are some of the contraindications. Now, all these medications, whether it be a triptan or an ergot alkaloid, they cause vasoconstriction. So, if you can think, what is the contraindication to giving these medications? If a person already has some condition which causes so much vasoconstriction that you do not want further. For example, if a person has severe hypertension, or for example, a person has severe constriction of their arteries, you do not want to give these medications to those patients because it can worsen the condition. Now, what is the prophylaxis? So for prophylaxis, you can put the patient on something like a beta blocker. You can advise them to have lifestyle changes, and also you need to make sure that a person does not overconsume these medications. So a better resolution for them is to make sure that they sit in a cool and a dark place, which is going to help them with the migraine headache. Now, moving ahead to the next one is tension headache. How do you differentiate between tension headache versus the other types of headaches? A tension headache is bilateral. It feels like a band around the forehead. Now, this pain can last for as long as 6 hours. So, what's the most common treatment that a person can have for tension headaches? First, you need to try and avoid the stressor. And then, if you cannot, the next best management is to take NSAIDs. But again, we do not want to overconsume NSAIDs because then it can lead to something called a medication overdose headache. So what is a medication overdose headache? So for example, a patient comes to you and says, "Doctor, every morning I wake up with a headache." So the first thing you want to check is what are the medications they are taking. Are they consuming any medications which are associated with headaches? Or for example, are they chronically taking any NSAIDs or any other pain meds like acetaminophen or anything else which can also trigger these headaches? So what is the treatment for a medication overdose headache? As you all can figure it out, it's basically to stop the medication. So medication overdose headache, you stop the medication and the headache should go away. For tension headaches, you usually try to avoid the stressors, but in case the headache is severe, you can use NSAIDs. For migraine headaches, we said prophylaxis is beta blockers, and for acute crisis, you can give them NSAIDs, ergot alkaloid, or a sumatriptan. And for cluster headaches, we said acutely you can give the person 100% oxygen to breathe, or a sumatriptan, and for prophylaxis, we said something like a verapamil. I hope this helped you to understand the different types of headaches, how you can differentiate them on the basis of symptoms, and how you treat them differently, and what are the contraindications to some of the medications that we use for these headaches. Thank you so much.
Observerships, doodles, CVs, interviews, we help you match stronger. Contact me at connect@drsinghmd.com.